The OmniAccess Hip Retractor systems have evolved out of the need for an effective modern exposure tool for use on traditional and minimally invasive approaches to total hip replacement. Through improved surgical exposure, OmniAccess reduces surgical time. Eliminating handheld retraction frees OR staff to do other tasks. Repeatable, consistent performance improves overall surgical process for surgeons and hospitals. The following program will guide you through proper system setup and provide cleaning and sterilization instructions. Place the sterile field clamp onto the OR table rail just below the anesthesia drape. Clamp placement should be a minimum of 31 centimeters from the top of the incision. For anterolateral approaches, place the clamp on the same side as the primary surgeon. For posterolateral approaches, place the clamp on the opposite side of the table from the primary surgeon. Locate the table rail underneath the drape and engage the lower jaw of the clamp on the rail. Tighten the knob at the top of the post until the post is firmly attached to the rail. With the securing handle of the post clamp in the downward position, insert the support arm into the clamp and position the arm over the patient. It is recommended that post and support arm placement and positioning be considered as final steps in the draping procedure. The clamp at the end of the support arm rotates to allow for final positioning along an imaginary arc 10 centimeters above the incision. An important consideration in the final positioning of the support arm will be the plane of approach required for femur reaming and broaching. The support arm and the large clamp at the distal end of the arm must be positioned so they will not interfere with this step of the procedure. The arm should be no more than 3 to 6 centimeters above the horizon of the patient. Lock the support arm position by pushing up on the securing handle. Before attaching the frame arms, make sure the large handle at the end of the support arm is in the unlocked position. Attach the frame arms to the support arm by inserting the end of the frame into the socket of the ball joint. There are flattened sections of the frame arm that will correspond to the ball joint socket. The frame arms may need to be rotated within the socket in order to line up with the flattened sections of the ball socket to engage properly. The short wishbone frame arm is recommended for use on the contralateral side of the patient to facilitate range of motion testing. The wishbone frame can be adjusted so that it is at or below the horizon of the patient. Proper positioning allows the patient's anatomy to present through the frame, above the plane of the frame arms. Be sure that the arms are equidistant from the incision and at a minimum of 33 centimeters apart. Lock the frame arm position by pushing the large handle back and away from the operative field. OmniAccess articulating blade holders provide a unique way to manage soft tissue. Unlike handheld Homan-style retractors with tips that stake into the patient in order to lever soft tissue back, OmniAccess blade holders mechanically retract fascia and muscle. OmniAccess blade holders allow you to toe in the retractor blade and then retract tissue back with the frame acting as the point of fixation. The exposure obtained by Homan and Cobra handheld retractors can be described as cone-shaped, with a greater amount of movement at the top of the wound than at the level of the acetabulum. The OmniAccess system allows you to reverse the exposure cone, providing greater movement of retractors deep in the wound, with less necessary movement at the incision level. The result is better exposure through small incisions, less incision stretching, and reduced profile around the operative field. Attach blades to the blade holders by snapping the nipple of the blade up into the distal end of the holder. The release button on the side of the blade holder allows the clamp section to traverse back and forth. Before placing a blade into the incision, be sure the clamp section of the blade holder is as far back toward the proximal end of the holder as possible. Also make sure that the tip of the blade holder is in a neutral position, parallel to the blade holder shaft. The proximal knob adjusts the position of the blade holder tip. Notice the range of motion the distal end of the blade holder has when in the neutral position. This is important for maintaining exact blade placement in the wound while approximating the blade holder clamp position with the frame. With the blade attached to the holder, place the blade into the desired position in the wound. While the surgeon maintains the blade's position, align the clamp with the frame arm. This will require depressing the release button on the side of the blade holder clamp, sliding the clamp to the proper position. Making sure the clamp handle is unlocked, snap the clamp on by squeezing the frame and clamp body between the thumb and forefinger. Lock by pushing the securing handle in a clockwise direction. While continuing to maintain the blade's position on soft tissue, the proximal knob is turned clockwise to toe in the blade to the appropriate angle and depth. The key at the top of the clamp can be turned clockwise to retract the blade backward. Additional toeing in of the blade and lateral retraction can progress to obtain the desired exposure. The best exposure results are achieved when OmniAccess retractor holders have been placed on both wound margins prior to fully retracting. Retracting vigorously on the first blade placed in the wound can cause the frame to shift and may limit the placement of other blades. Handheld Homan and Cobra-style retractors can be used with the OmniAccess retractor. After placing a handheld retractor into position, place a strap clamp holder onto the frame in close proximity to the retractor handle. Lock the securing handle of the strap clamp holder by pushing the handle clockwise. Wrap the strap around the retractor handle several times and cinch the strap into the V-shaped notch of the holder by pulling down on the strap. The strap clamp holders are also useful in securing femur elevating retractors. Before placing the retractor, position the OmniAccess frame arm inferior to the level of the surgical field, so that the final position of the levering retractor is above the frame arm. Attach the strap clamp and secure the retractor. Femur reaming is accomplished over the top of the secured retractor and frame. Physicians using the OmniAccess retractor agree that it provides reliable, consistent exposure regardless of patient size, helps reduce incision length, and with average setup time in less than 60 seconds, the versatile OmniAccess system does not interfere with surgical technique. Ultrasonic cleaning is recommended. Power washing or hand scrubbing with a soft brush is acceptable. The articulating blade holders have a flush port in the center of the proximal knob. Flushing these devices is recommended. For more information, contact Omni-Tract Surgical, 4849 White Bear Parkway, St. Paul, Minnesota 55110. Visit our website at www.omni-tract.com or call 1-800-367-8657 or area code 651-287-4300.